According to AlabamaMedicine.org, published June 22nd, 2017, about 91 Americans die every day from this. In 2015 alone, this accounted for 33,000 deaths. These startling statistics are the result of opioid overdoses. With the large proportion of people affected by this, most everyone is subject to interacting with someone who is dealing with addiction, whether that's a family member, friend, acquaintance, or yourself. With proper information, I hope to combat against this. This subject hit close to home with experiencing my younger brother falling into substance abuse and thankfully getting help with a local rehabilitation center here in Birmingham. In the modern medical field, there is an abundance of opioid prescription for multiple different reasons. Today, I will be giving a solution to Alabama's opioid crisis with the legalization of medical marijuana. First, I will give you statistics on the Alabama opioid crisis. Second, I will tell you what opioids are. Third, I will state the cause of the crisis. And finally, I will give you reasons why medical marijuana would help against opioid abuse. That being said, let's tackle the first point, statistics on the Alabama opioid crisis. As described by the Alabama Department of Mental Health webpage, which was updated January 2020, the opioid crisis is a public health and economic crisis that is eroding the quality of life for Alabama residents. According to CDC.org, published June 27, 2019, 70,237 drug overdose deaths occurred in the United States in 2017. From 2006 through 2014, there were 5,128 deaths from overdoses in Alabama. The state's death rate per 100,000 in 2014 was 14.9. In 2012, Alabama was first place in the nation per capita for opioid prescriptions with 143.8 prescriptions per 100 residents. Now that we've described a couple of the problems at hand, let's take a look at the second point, what opioids are. According to drugabuse.org, visited March 22nd, 2020, opioids are naturally found in the opium poppy plant. Some opioid medications are made from this plant, while others are made by scientists in labs. Opioids are used as pain-relieving medicines. According to the Alabama Department of Mental Health, updated 2020, opioids are broken down into these couple of drugs. Heroin, which is a highly addictive drug made from morphine, which comes from opium poppy plants. Fentanyl, which is a powerful synthetic opioid, which is 50 to 100 times more potent than morphine. Oxycodone, which is a pain reliever. Hydrocodone, which is the same. Codeine, morphine, and many more. Now that we know what an opioid is, let's take a look at the third point, the cause here in Alabama. According to Daniel Doley's PhD, clinical psychologist, director, and owner of the Doley's Clinic in Birmingham, in the article Opioids in Alabama, Where Do We Go From Here?, published June 2017. The altruistic nature of medicine itself could be one of the primary factors involved in today's opioid crisis. Physicians are trained in the healing arts and simply want to heal their patients. This leads physicians to treat patients with the mindset of let's take 2 a day and see how you react, and if it does not change, we'll up the dosage. This leads to a common abuse and dishonesty between patient and doctor, which has been seen to be part of the overprescription issue. Dr. Doley goes on to describe this as the often unrecognized position assumed by the well-meaning doctor that I'm committed to saving this patient from suffering, and if this patient is still suffering, then I need to keep going until I find a cure. That being said, now that we've looked at one of the primary causes for opioid abuse, we will now look at the final point, reasons why medical marijuana could help against opioid abuse. Marijuana comes in many different forms, whether through smoking or oral application. According to marijuanadoctors.org, reviewed by Dr. Joseph Rosado, updated on December 6, 2018, medical, both opioid and cannabinoid pain-relieving effects work by binding the receptors at your cell's surface and setting off a series of events in your cells that lead to a pain blockage. Because of this, researchers theorize marijuana supplements opioids' effectiveness in managing pain. When you use morphine and THC, which is a compound in marijuana, simultaneously, for instance, you get the same pain relief level at lower doses compared to if you were just receiving morphine alone. Opioids and marijuana do similar things in your brain as far as blocking the signals of pain and causing you to feel good. However, cannabinoids such as CBD, CBC, CBN, and THC also work methodically to decrease inflammation and relax damaged tissues in your body. More than 75% of individuals addicted to opioids were able to wean off and replace opioids with marijuana. Furthermore, in states that have made medical pot legal, opioid overdose fatalities have decreased by 24.8%, according to marijuanadoctors.org. Since CBD, which is a byproduct of marijuana, helps treat withdrawal symptoms, prevents relapses, and breaks the addiction cycle, it could help treat opioid abuse and addiction in the U.S., which will lower opioid prescription rates and reduce the risk of overdose. In conclusion, the access to a safer alternative to pain management is the key to decreasing the need for opioid-related prescription. Through the legalization of marijuana, there's an alternative presented that can reduce the minor pain-related patient without the dangerous addiction that is prevalent in abuse today. I have told you first about the opioid crisis, what an opioid is, the cause of the crisis, and reasons why medical marijuana would help against opioid abuse. Now, with this knowledge, you will be aware of the problem presented with opioid usage. Hopefully, this information will help those who have a medical need for the substance to be more hypersensitive to opioid effects and the negative aspects of its abuse. With this, I hope that one day the solution of medical marijuana is applicable to the patient who needs it. Thank you.